If you have been using PubMed for a long time, you would have found many shortcuts and tricks for using PubMed. Stick on to that. Don't change these strategies just on, I mean, strategies can be different for literature search in PubMed. And if you feel that there are easier ways than what I talked, feel free to point out. So this will be a live session. I'll be demonstrating it online, how to conduct these things, how to conduct a proper search. And before going online, I need you to be familiar with these three terms: Medline, PubMed, and PubMed Central. Medline is it stands for Medical Literature Analysis and Retrieval System Online. So it's a database of more than 30 million records. For easier understanding, consider Medline as a library which contains 30 million articles. So Medline is the library which is maintained by United States National Library of Medicine. What is PubMed? PubMed is a search engine. So whenever you go to a library, there will be a computer where all the articles or all the books which are listed there. So PubMed is similar. PubMed is a search strategy or a search engine which searches the Medline. Now, apart from the Medline, PubMed searches few other things also. But for most practical in general, we can say PubMed is the search engine for Medline. Whenever a new article comes, whenever a new articles get published in a journal, before it gets indexed in Medline also, the PubMed searches it. It takes sometimes few weeks for a new article to be indexed in Medline, but PubMed can search even before it gets indexed in Medline. Other than that, mostly PubMed, think of PubMed as a search engine for Medline. Now the third thing is PubMed Central. PubMed Central is a collection of free articles, free open access articles. So Medline is the library, PubMed is the search engine for the library, and PubMed Central can be considered as the reading room associated with the library where you can go without the subscription to library and read a few books which are available there. So every library will have a reading room which has few books like Harrison, Robbins, or few standard books which are freely available. So PubMed Central is like a reading room, like where you have all the open access free articles available. So these are the basic difference between Medline, PubMed, and PubMed Central. So these terms should not confuse you. So we'll go to, I'll give you the live demonstration. So you start with your browser, search for PubMed, and click on the PubMed. So this is the new PubMed interface. So now this interface is relatively new. Many of you who have used PubMed previously will find that the previous interface is slightly different. This new interface is more visually appealing and has got some newer features. We need to be familiar with that. And people who have been using PubMed for a long time find it very, I mean, some people find it very uncomfortable when this, found it very uncomfortable when this change was made. But once you get used to this new interface, it's very convenient and it's very easy. So this is the basic PubMed homepage. So here you have the NIH NLM logo. Here you have the PubMed logo. And this is the important thing. This is the search bar where you type your search query and then click on search. Apart from this, you have an advanced search option where it goes into, if you click this, it goes into an advanced search strategy builder. There are other things also where you get user guides and frequently asked questions and some other tools also, which we will see now, especially this mesh database. So let's start with the PubMed search. Suppose you have a, so I am a rheumatologist, so I'm interested in lupus, those kind of diseases. Suppose I have a seminar on lupus nephritis. So I start with typing lupus nephritis. Can somebody confirm if I'm audible and if things are visible?
Yes, audible.
Yes. Okay. So lupus nephritis. So I want a search on lupus nephritis. I have a seminar on lupus nephritis. So I search for lupus nephritis, click on search. So this is the search interface. Here you have the, whatever you have searched, here you have this, here in the search bar. Here there are some options which we will see later, especially this email thing which you are asked to do after this session, which is important for getting that point and passing this course. So there are almost 11,000 results which has come for lupus nephritis. All the articles on lupus nephritis which are indexed from Medline from the beginning of time are given here. So there are multiple options to refine your search. Here the articles are given in such a way that it is sorted by best match. You can have other sorting also. You can sort by most recent articles first. So for this, you click on the display option. Click on display option. You sort by most recent article. So now most recent article comes first. This is the 2020 September, October. And the most oldest article comes last. So other options here are you can search by best match, you can search by first author, you can search by journal, depending upon your convenience. So I'll go back to best match. There are other tools in PubMed which will help you to refine PubMed search. So this is the timeline toolbar. So here you can see all the articles which are published from 1947 to 2020, 2021 is given here. So you can actually customize these things. If you want only articles which are published after 1990, then you can just drag this button towards right and keep it here. Now this will reload itself and all the articles which are from 1990 to 2021, all the previous articles will be discarded. So you can, if you want only articles before 2010, you can do this. So this is how you play around with timeline. If you want an article during a particular period of time, you can do this. I'll just reset these things. Now the other options to refine searches, here you have text availability where there are three buttons: abstract, free full text, and full text. Free full text means all the articles which are freely available in PubMed Central will be showing. So suppose you don't have subscription for all journals. So this search will give you all the articles, but you won't be able to see all the articles after clicking that. But you need only free full text articles. You click here. Now all these articles are freely available. You click here, you will get the full text. If you click on the free PMC article, so you will get the free full text things. So now you are working in SGPGA. So SGPGA will have subscription for most journals. So that won't be an issue if you are logging with your SGPGA ID. But when you come out of SGPGA, practically you won't have subscription for anything. So you will basically need only free text articles in your search so that you can go and see that article. Otherwise, you will have to use some pirate website like Sci-Hub for viewing the article. So I'll unclick that. Now there are other options for refining search. Now this is showing all type of articles. But usually when you present a seminar, you start with a review article. You start with the best review article available and you build around that review article. That's how we usually make a seminar. Suppose I want to make a seminar on lupus nephritis, I want the best review article. So all the junks can be discarded and I want only the review articles. So I click here. So now all the review articles will come and you can select whichever review article which you need to pick. Now, other than the article types, you can show, you can have your search. Other than the review article, you can have your search by publication date. If suppose you want to have the publications, which all the publications which are published in last 1 year, you click here, then you will get all the publications which are published in last 1 year. Similarly, you can have a custom range of publication. Suppose you want all the publications which are on lupus nephritis after the 9/11 attack, you can actually type your date here. Now this will show all the articles on lupus nephritis after 2011, 2001, 9/11. So these are some of the things by which you can refine your search. I'll reset all the filters. Apart from these 5 types of articles, there are other additional types of articles also available. You click on additional filters. There are different types of articles listed here. Suppose you want only phase 3 clinical trials of lupus nephritis. You want articles only about phase 3 clinical trials of lupus nephritis. You select this phase 3 clinical trial. Click on show. Now this, whatever you have selected will come in the article type. Click here. Now all the phase 3 clinical trials on lupus nephritis will come here. So this is the basic search interface. You can sort these articles based on best match, based on the, whether it is recent or not, based on the journal in which it is published. You can actually fine tune the search by dragging this timeline to your convenience. You can search only free full text article if you want. So if you can search by article type, you can search by publication date, and there are other additional filters which we have seen now. Now coming towards a systematic approach towards searching lupus nephritis, that was just an example, but many a times you need to answer a specific question. Suppose in rounds your consultant asks you regarding the evidence of thrombolysis in pulmonary embolism, and he asks you to search literature and come back and tell tomorrow. So you need to start with a good research question so that you get a better yield out of PubMed. So the question was thrombolysis in pulmonary embolism. So you start with a good research question. I'm sure there was classes on research question previously. What you were taught as PICO strategy. So basically there should be a population, there should be an intervention or an exposure, and there is an outcome. The population in this example is patients with pulmonary embolism. Intervention is thrombolysis, and outcome is mortality or morbidity. So all good research questions should have these aspects: a population, a determinant, and an outcome. Once you have these things, you can go in for a PubMed search. So basically, PubMed search it requires your knowledge to identify what is your population, what is the intervention, and what is the outcome. Then you need to create a logic using certain Boolean operators, which we will see now. And there should be some creativity which will come with time. Always whenever you use PubMed, mind you that certain synonyms, you should be taking care of that. Like if you are searching for cardiac failure, all the articles for which keyword is cardiac failure will come. But sometimes the articles for which keyword is written as heart failure, those things can be missed. So certain synonyms should, many diseases has synonyms, and these things should be taken care of whenever you do a PubMed search. It will be clear when we discuss an example. And also these things, some things have a different UK spelling and US spelling. We need to take care of that aspect also. So these are the Boolean operators. Basically, there are 3 Boolean operators: the and, or not. Always remember that the Boolean operators should be written in capital letter. Unless you write it in capital letter, the PubMed will not recognize it as a Boolean operator. The and operators is like whenever you want, if you want to search for hip fracture, you combine the keyword hip and fracture with and. So hip and fracture will give you all the articles for which the keyword has both hip and fracture. So it will not take hip arthritis, it will not take leg fracture, it will only take hip fracture. In contrast, if you use hip or fracture, so it will take hip fracture, it will take leg fracture, and it will take hip arthritis. So that's the purpose of or. If you want both, you use or. If you want something in which both are there, you use and. Renal or kidney. Like if you want articles for which keywords are renal and article for which keywords are kidney, if you want both, use the Boolean operator or. Another tricky Boolean operator is not. It's used to exclude things. It's very tricky to use this not. Usually it's not encouraged to use not as a Boolean operator in PubMed search, but still you can use that. So suppose you want articles on patients with renal involvement without failure. So you use the not Boolean operator, renal not failure. The search will give you all the patients who have all the articles who have which have renal involvement, but not the articles which have renal failure. So as I told you, the search strategy should have a population, should have a determinant, and should have an outcome. The population, so usually what we do is we do a 3-step search. The search one is for population and its acronyms and its synonyms. Search 2 is a search for the determinant and its synonyms. Search 3 is a search for outcome and their synonyms. And finally, we have a search for, which is the master search, where we combine search 1, 2, and 3 by the Boolean operator and. I'll show you with an example, then that will be clear. So suppose your consultant asks you in rounds that whether renal involvement increase mortality in systemic lupus erythematosus. Now this is a well-framed research question. So there is a population, there is a determinant, and there is an outcome. The population here is patients with systemic lupus erythematosus. The determinant is renal involvement. The outcome is mortality. So we need to make a search strategy. We have the knowledge, we have the population, determinant, and outcome. We need to make a search strategy for this. So the population is patients with systemic lupus erythematosus. But many articles will have different keywords for the same disease. Some articles will be writing SLE, some articles will be writing lupus, some articles will be writing systemic lupus erythematosus as keywords for that article. So we need all articles regarding SLE, whether it is written, whether the keyword is SLE or lupus or systemic lupus erythematosus. So what we do is we combine these keywords with the Boolean operator or. So we go back here. This is the interface. You go to your advanced search builder. So this is the PubMed advanced search builder. I'll delete all the history which I had searched previously. So this is the advanced search builder. So our population was the patient with SLE or lupus or systemic lupus erythematosus. So this is our search one. You add this search one to the query box. In the query box, your search will come, and then you click on search. So this search gives you all the articles on systemic lupus erythematosus, whether the keyword is SLE, whether the keyword is lupus, or whether the keyword is systemic lupus erythematosus. Now you go back to the search by clicking on advanced again. Now you can see the history of first search, which is written as #1. The first search is SLE or lupus or systemic lupus erythematosus. So we have the population now. So I'll go back to my slide. The second thing is here is determinant. In our example, the determinant was renal involvement. Renal involvement, the keyword may be renal, the keyword may be kidney. In SLE, the keyword may be proteinuria, keyword may be nephritis. So we need all the articles which discuss these things regardless of the keyword. So we combine these things using the Boolean operator or. Go back to search. So we'll search for renal or kidney or nephritis or proteinuria. Now you click on add, click on search. So this is the second search on determinant. So it's renal or kidney or nephritis or proteinuria. You have more than 1 lakh results. You go back to your search. So the second search is on renal or kidney or nephritis or proteinuria. And the third thing here was outcome. Outcome here was mortality or death. So some articles will give the keyword as mortality, some as death. You want both, you combine with or. So mortality or death. You add to query box. Now instead of searching, you can also just add to history. So here there is a drop down button. You just click on add to history. So there is a first, we have the search history. First search was on population. Second search was on determinant. Third search was on outcome. Now all you need to do is combine this. You need patients of lupus who has renal involvement and the papers discussing mortality. So you combine these three using the Boolean operator and. So what you do is here you select the first search. So you type #1. #1 represents first search. Now combine it with the second search and then you take the second thing. It's renal or kidney or nephritis. This is the determinant. So in history 2 is for the determinant, and then you combine with the outcome #3. So 1 and 2 and 3. Then you click on search. So now you have all the papers which discuss lupus nephritis, mortality, and systemic lupus. I mean, systemic lupus nephritis with renal involvement and mortality. So this is how you conduct a finds search for research questions. So before starting a research question, you need to have a good research question. Before searching PubMed, you need to have a good research question. You need to identify what's your population, what's your determinant, and what's your outcome, and combine using various Boolean operators like or and and. These are called logics, and for doing this, you should have some creativity, which will come with time and experience. We'll see some other options. We have other search options here also. Suppose you want to search the publications of an author. Like if you want to know all the publications on lupus by Professor Amita Karwal, what you do is first here you have already you have a history of SLE. In the history you have SLE or lupus or systemic lupus erythematosus. Now if you want to search by author, so here instead of all fields, click here, use author, and write the name of the author. You add this here. So in the query box, it will come as author's name, and in the square bracket, the author will be there. And add to history. So the fifth search in the history is for the author. So you want to know all the publications on lupus by MAM. So you combine 1 and 5. 1 for all the lupus papers, 5 for all the papers by MAM. And when you combine this, you add it to the query box and search. So you'll get all the articles which are published on lupus nephritis by Amita ma'am. So that's how you search things by author. Sometimes you need to search things by journal. Like whenever you present a journal club, you need to present articles from a good journal. Suppose you thing you need an article from NEGM on lupus for you to present in your journal club. So you can select that also. In the all fields, click on journal. Here type New England Journal of Medicine. Select this, add. So in the query box, the journal's name will come, and in the square bracket will be given journal. You add this to history. You want all the articles on lupus that were published in NEGM. So you combine first search #1 with 7th search, which is for New England Journal of Medicine. You add it here and click on search. So you have all the articles which are published in NEGM on systemic lupus erythematosus, almost 400 results given here. That's how you search by author. That's how you search by journal. And there are many other options. You can search by language. You can search by mesh terms. And there are many other options. You can explore this by your own. Now, one other thing which you need to know in PubMed is the use of truncations. Suppose you need to write a review article on SLE on vascular manifestations of systemic lupus erythematosus. The problem is various vascular manifestations will be given. Some will be given as vasculitis. Some manifestations will be vasculopathy. Some will be as atherosclerotic vascular disease. So you need to combine all this. So one strategy is to know all these things, like the search 2 will be vasculitis or vasculopathy or vascular. An easier way will be used to use the truncation. You type VASCUL vascul and then give an asterisk. So whatever may be coming after this, it doesn't matter. Any keyword which start with vascul will be coming in the search. So instead of typing this entire thing for something, here you have to write only 3. Sometimes you may need to write like 5 or 6 keywords with combining with or. Instead of that, you can use the truncations, but always use truncations wisely. I'll show you how truncations can be used. So you need to know about the vascular manifestation. You just write VASCUL and then give a asterisk, add to history. You need the first, you combine all SLE papers and search 9, which is for vasculitis. All the keywords which starts with VASCUL. You add here, add to history. So this is 1 and 9. So all the articles on vascular manifestation on systemic lupus erythematosus will be coming here in this search. The other thing you need to familiarize is the usage of mesh terms. So suppose I have some instance, I'll use this only. Suppose you type reactive arthritis, you need to, you have a seminar on reactive arthritis, you want to study about reactive arthritis. You type reactive arthritis in the search bar and enter search. So many articles will come, but see the first article which has come, you click on this. And when you read the abstract, you see this paper has got nothing to do with reactive arthritis. Just because the paper had arthritis somewhere in the keyword and somewhere in the abstract there was a word called reactive. This search engine identified this paper to have some relevance for reactive arthritis. So that's the problem with PubMed search. It's like a Google search. It will give you non-specific results. To increase specificity, one thing that you can do is to keep this thing in inverted comma, double inverted comma. So if we keep reactive arthritis in double inverted comma, the PubMed search will identify only those articles for which keyword is this complete reactive arthritis. So we type reactive arthritis in inverted comma and then click on search. So all the articles for which reactive arthritis keyword appears will be listed in the PubMed search. But again, this has a problem. Look at the first article. You click here. This article, if we read it carefully, it's again not on reactive arthritis. It is about something else. But in the discussion part or somewhere, there was some discussion about reactive arthritis. That's why this paper was coming in the search. So adding inverted comma increases specificity, but not to the extent, not to its complete extent. So for complete specificity, there is this thing called mesh terms. Whenever an article gets indexed in Medline, the operators in the National Library of Medicine manually assign certain mesh terms to that article, which each article will get 5 mesh terms which are relevant for that article. And so these mesh terms, if we search using these mesh terms, the search will be very fine and very refined. So mesh terms is comprehensive controlled vocabulary for the purpose of indexing journal articles and books in the NLM. It's created and updated by the operators in United States National Library of Medicine. So how do you search by mesh terms? So this was the PubMed interface. Here you can see a link for mesh database. You click on mesh database. So another window will appear. This is for mesh database. Here you can type your query, be it a disease, be it a condition. Here you can type in the search bar. And if you search, the mesh term will come. Suppose you want to know the mesh term for cancer. The cancer will have many terms like cancer, malignancy, neoplasia. So we don't know what the mesh term for cancer is. So what we do is we type cancer here and then search. So it will show the mesh term for cancer. The mesh term for cancer is neoplasm. Click here. So any article on cancer will be indexed in Medline under the mesh term neoplasm. There is no mesh term called cancer. There is no mesh term called malignancy. Any article will be indexed under the mesh term neoplasia, and then there will be subheadings. Now coming back to reactive arthritis, if you type reactive arthritis in the mesh search bar, it will give you reactive arthritis. What you do is add this mesh term to the search builder. You click on add to search builder. So the mesh term will appear in the PubMed search builder, arthritis reactive, and mesh will appear in square bracket. Now when you search PubMed using this mesh term, you see all the articles which are relevant for reactive arthritis only will appear. There will not be any junks. You'll be so refined that you get only articles on reactive arthritis and not on other things. So this is the use of mesh terms and for searching. I'll give you another example on how to use this refined search using mesh terms. Suppose you have a research question. Is it safe to give flu vaccine to patients with allergy? So what you do is you go back to home page. Here you have mesh database. Click on mesh database. So our question was, is it safe to give flu vaccine to patients with egg allergy? So we don't know the mesh terms for any of this, but you still type flu vaccine. You search. So the mesh term for flu vaccine is influenza vaccine. Click on influenza vaccine. You need to know if there is any side effect for influenza vaccine in patients with egg allergy. So there are various subheadings under the mesh term influenza vaccine. One of this is adverse effect. Click on adverse effect and add to search builder. So this is the mesh terminology for adverse effects for influenza vaccine. So this is there in our search builder. So our next thing is patients with egg allergy. Again, we don't know the mesh term for egg allergy. Still we write egg allergy and type and search. So the mesh term for egg allergy is egg hypersensitivity, which comes here. You add this egg hypersensitivity to the already what you have in the search builder which you have filled with influenza vaccine and adverse effects. You add it with the and option. So you click on add to search builder. Now there is influenza vaccine, adverse effects, and egg hypersensitivity. Now click on PubMed search. So you'll get an absolutely refined search where you have articles for which mesh terms are influenza vaccine and egg hypersensitivity. So whenever you write a systematic review or whenever you need to address a very focused question on a broad topic, use mesh terms like what I've shown now. The problem with using mesh is it has too much precision that sometimes relevant articles can be missed. And indexing in Medline takes a few weeks, like 3 to 4 weeks for each new article. Whenever a new articles come, indexing takes time. So these articles which are not yet indexed and about to be indexed, those will not come when you use mesh search. So whenever you, for all practical purpose in making a seminar or presentation or addressing a question, you use the normal search only. But after the normal search, you can refine your search using this mesh search. And mesh search is particularly important when you write a systematic review or when you need to address a very focused question on a broad topic, where the routine search will give you large number of articles and it's very difficult to find the relevant article from that. Then you go for a mesh search. The disadvantage of mesh search is that it may miss some of the relevant articles. And I'll come to the last session of this talk, how to personalize PubMed. You can always log in PubMed using your Gmail ID. Always make sure that you log in with your PubMed ID or Gmail ID whenever you use these things, because this will go into your history, and whenever you need to make a same search again, it will be easier for you. There are many other options by which can help you in PubMed, like save, mail. So if suppose you want to save some of these citations, some of these articles, suppose these 2 articles, I find it very relevant for me, I want to save it for a later purpose, you can always select these articles and click on save. So these 2 selections will be highlighted, and then you click on create file. A new text will be found which will save your citation. Suppose you need to mail this article, this citation to somebody. Suppose your consultant asks you to mail him or her the relevant article. You click the relevant articles, click on email. Here you type the mail address, here the selection, and send email. So this is what you are supposed to do at the end of this session for you to get marks and pass this 01 session. Create a PubMed search on whichever topic you are assigned or whichever topic you are doing research on, and select the best 10 and mail it to the ID which is given to you. There are other options. You can save your collections. Suppose I find these 3 articles relevant and I think that in future also I need these 4 articles. So I can save this search under collections. You click on send to, you click on collections, and here this box, this thing will appear. Here you create a new collection and you name the collection as a gallery or whatever you need, and then click on add. So new items were added to your collection, and there is option for editing my collections. So all the collections which I have made previously also will appear. So to retrieve these collections, you go to this button. Here your dashboard will appear. Click on dashboard. So this is my personal PubMed page, which shows all my recent activity, my bibliography, all the publications which I have made so far, and collections which I have made just now. So there's a new collection which I have added. So this will be here permanently. So I can, whenever I need, I can click here and retrieve the search. So to conclude, PubMed is a powerful search engine with more than 30 million citations. Before attempting a PubMed search, start with a good research question. And by experience, you'll have a smart, logical, and creative strategy for PubMed search. Try working around these things. It's very easy. It's not as confusing as it sounds. So try working around this, and PubMed will give you excellent results. Make maximum utilization of PubMed for a effective literature search. Use these Boolean operators, but not is not a very good Boolean operator. Try to use not very sparingly, and use truncations wisely. Thank you. That's all from